The Federal Ministry of Health says it is committed to realizing global commitments on the Sustainable Development Goals SDGs 3 and 5 and attainment of universal health coverage, leaving no one behind. The Minister of Health, Dr. Sage Hanire, made their session in Abuja at a media briefing on the high-level platform called the Nigeria Reproductive, Maternal, Newborn, Child Adolescent and Elderly Health Plus Nutrition Multi-Stakeholders Partnership Coordination Platform. According to him, all the technical working groups have been established and are functioning smoothly, but added that gaps exist in achieving overall coordination of RMN CAEH plus N in the country. Ehanire said investment in the health and well-being of women, children, adolescents, and elderly is worthwhile.
No one institution can handle the task. From experience, we recognize that partnership for cooperation and collaboration is key, and that coordination of efforts can be a challenge. But the past partnerships for IMNCH at lower levels has now evolved to this high-level platform, which we are launching today, and which we have learned from the past and are now well-equipped and emboldened to tackle. Since the launch of Maternal, Newborn and Child Health Strategy in 2007, the National MNCH Partnership has been coordinated by the Core Technical Committee, leading to establishment of the technical working groups for each programmatic area in the reproductive, maternal, newborn, child, adolescent, and elderly health plus nutrition spectrum. The emergence of new issues around gender and public health emergencies, and most recently, the COVID-19 pandemic, with the attendant limitations in providing access to equitable quality of health services, has become an area of concern for global health and security. There is no doubt that the COVID-19 pandemic had its toll on routine healthcare delivery around the world, and at the initial phase, severely impacted services in Nigeria. However, lessons learned from the COVID-19 pandemic are being utilized to strengthen our health system and reposition it for more resilience to improve health and well-being of the vulnerable across the population life cycles of children, adolescents, women, and the elderly. We have made modest progress towards improvement of child survival and safe motherhood through provision of ready-to-use therapeutic food and sustaining the FP 2020 commitments to ensure availability of family planning services to women of reproductive age, among other things. In addition, operationalization of the National Health Act and the Basic Healthcare Provision Fund will greatly improve access to quality health care for the vulnerable, particularly at primary health care level. In realization of our vision to achieve universal health coverage while leaving no one behind, the Federal Ministry of Health is repositioning its approach to partnership to maximize impact for better outcomes. The vision for this multi-stakeholder coordination platform is to harness the relative strengths of the diverse stakeholders and create opportunities to leverage resources to maximize outcomes for attainment of our shared vision for Nigerians, particularly the vulnerable population among us. The motto, partnering for well-being of women, children, adolescents, and the elderly, encapsulates the core values that drive universal health coverage with the aim of leaving no one behind. Our responsibility for the well-being of women, children, and adolescents and the elderly takes cognizance of their roles in national development, since this group of people constitute a significant proportion of the Nigerian populace. However, this shared vision must be driven by stakeholders carefully drawn from with the criteria, and among which are passion, track record for work, all related to the well-being of women, children, and adolescents, and the elderly.